Hello, in this video we will discuss about the colorectal cancer, that is the bowel cancer, and it is affect the colon and rectum. This cancer is the basically the what is the cancer? You should need to understand the abnormal cell growth due to the external or internal changes or abnormal cell division and proliferation to change the DNA and mutation lead to dysfunction of the normal function of the organ. So here is the I am drawing the digestive system for understanding the. So this is the liver, stomach, large intestine, small intestine, and oral cavity and esophagus. So here I am drawing the bigger picture of the large intestine. Here is the appendix, and here is the ascending colon. Ascending colon which attached with the ileum, and in the here is the cecum and the transverse colon, descending colon, and sigmoid colon, and rectum. This rectum is also involved for this cancer. So what is the cancer here is we will discuss stage 0, which that is the cell is not differentiated, but it can lead to trigger the stage 1. In this way the stage 1 is basically the rapidly proliferation, and in this way the cell will be abnormal due to the mutation, and stage 2, which that is the cell division more rapidly due to the growth factor as well as other factors which that trigger the stimulation to produce more cells and abnormal cell due to the damage of the DNA. And stage 3 to stage 4 is basically is the metastatic and malignancy. So in this way here is we will discuss after this the stage 4, the proliferation of the cell. This stage 4 is very severe, and in this way it will go into the blood circulatory system, lymphatic node, lymph node, for the attack to the immune cell. So first it attack to the immune cell, so the immune cell dysfunction will be occur, will go into the heart and the circulation, and their target is the whole organs, the every organs which that is involved for this infection. So let's begin to understand damage in the lymphatics after go into the another colon. It can be again attack to the another part of the colon, so the whole colon can be infected due to the again proliferation. So the residence where the residential place will be selected by this stage 4th cell, so it can be proliferate and spread to other organs, and after these other organs it will lead to hypermitotic division. This hypermitotic division will lead to suppress the normal cell division while it will grow and require more energy. So the nausea, vomiting, as well as other weakness can be occur due to the high energy consumption, while due to the DNA mutation or other function or methylation. So here is the stage 1 in the colon, so that in the colon, and stage 0 to stage 1 to 2, and stage 3 to 4. After this fourth stage, the hyperplasia. In this way the hyperplasia is the detachment of the some cell to go into the blood circulatory system. So here is the colon, and inside is the blood vessel. When go into the circulatory system, so the spread to other organs. So it will spread to other organs, for example liver, pancreas, kidney, lungs, and brain will infected, and the stage 4th is uncurable, while the stage 1 and 2 can be curable until it will not go into another organs. So inflammation, hyperplasia, and dysfunction of some organs will be occur. So let's begin to understand about the risk factor. What is the risk factor? So the dietary factor, it means the not good healthy diet, for example red meat, processed meat, bad eating habits, overeating, so that is all things, and alcohol consumption and other the drugs which that medicine can affect these the dietary factors due to the digestive system. While the inflammatory bowel disease, this inflammatory bowel disease will cause the inflammation in the A large intestine, it is a group of inflammatory condition of the colon, and small intestine, Crohn's disease and ulcerative colitis being the principal types which can cause the cancer in the colon and colorectal cancer. While here is the genetic disorders. Genetic disorder means the familial adenomatous polyposis. This adenomatous familial adenomatous polyposis is a FAP, is an in herited condition. Adenomatous polyposis form mainly in the epithelium of large intestine and lead to benign into colon cancer when untreated. A non-polyposis colon cancer, however, these represent 5% of cases, while the other is basically the major cases of the polyposis is an FAP, familial adenomatous polyposis. So let's is the identification by biopsy, CT scan, ultrasound, and gene and protein test we can done in the lab. So the laboratory will provide this biopsy as well as the CT scan. And on the other hand, the other thing we will discuss also here is the treatment. So the treatment we will discuss. What is the treatment? The decision on which aim to adopt depends on various factors including health, preference stage of tumor, and surgery. Surgery can be after the colonoscopy and biopsy, so it will recognize and check. So the surgery is very important for the removal of the part during the stage 2 and stage 3, while the colonoscopy and biopsy will use the endoscopic mucosal resection and endoscopic submucosal dissection. So the endoscopic means the inside, the scopic means the checking via a camera. So the chemotherapy may used before surgery to shrink the cancer before attempting to remove it. So after the chemotherapeutic agent will use for the shrinking of the cancer site, and the chemotherapy for 3 and 4 colon cancer is used and is integral part of treat for this. And their agent is the fluorouracil and capecitabine and oxaliplatin. So inhibition in the inhibitors we can use for the inhibition of the proliferation is the epidermal growth factor receptor inhibitors and aflibercept and cetuximab and pentimumab, penti, pen, pen, panitumumabs, which that is used, and the chemoradiotherapy as well as immune therapy and exercise and good health and food. Normal food is the important for the treatment part. So the sign and symptom, if we will discuss about the cancer, so here is the abdominal discomfort, cramp and gas or pain, and during the go into the washrooms, so bathrooms. So the rectal bleeding in the rectal bleeding, blood in stool will be occur, and on the other hand the gas or pain will be occur, and the diarrhea and constipation, a narrow stool that lasts for more than a few days. So that is why the narrow stool will be occur, and the stool will be feeling not empty gastrointestinal tract and changes bowel habits and bowel obstruction. So the bleeding is the important part for the first sign. On the other hand, if we will discuss about the another things, so the abdominal discomfort and cramps as well as the pain will show. But there are a lot of dysfunction can lead to pain, but we can identify. So the loss of appetite, due to the loss of appetite, due to the changes in our body, so the cancer cell. And this loss of appetite will losing weight without trying to lose, and nausea, vomiting, and bloating and discomfort the abdomen. So here is a vomiting. So after the vomiting basically will lead to weakness, and the weakness and fatigue of the muscle, because the less energy requirement, but the less energy consumed, but the requirement of the energy for the rapid cell proliferation will lead to fatigue, and ultimately it will stage 4 to lead to complication and death. So the colorectal cancer is treatable before